Is vaginismus lifelong or does it develop suddenly? That's a great question. There are historically there are like two kinds of ways these issues develop. One is primary and one is secondary, right? Primary meaning it has always been there. You don't know where it started, you don't know why it started, but as long as you have known, it has always been there. What I mean by that is for the very first time the person tried to insert anything inside their body, it was painful or impossible. That's called primary or lifelong vaginismus. I don't like that word because lifelong implies that it's not going to get better, which is not true, right? So let's call it primary vaginismus. Typically, patients will feel like when I was a kid, I was never able to use a tampon. So I just learned how to do it without tampons. And then later on, I was at a doctor's office and could never get a speculum exam. And then that goes on to never being able to have penetrative sex, right? So that's how primary vaginismus shows up. It shows up the very first time you try to put anything inside your vagina. Secondary vaginismus is when there is a period of no problem. There is a period of pain-free, penetrative sex, followed by suddenly it is impossible to put anything inside the vagina. That typically happens if there is an event, a trauma, or like an episode of some sort that caused body to react that way. Sometimes the event is very obvious and physical, like childbirth or tearing or surgery or cancer or anything that affected the tissue of the vagina itself or muscles of the vagina itself. Sometimes it is in the neighboring area, like really bad back pain, tailbone injuries, hip injuries, or surgeries elsewhere which affect the pelvic muscles and the core, and then that goes on to developing vaginismus. And other times the trauma might be more psychological, like something very catastrophic has happened, like a loss or assault or abuse or some significant shock to the body where the body shuts down, and one of the symptoms is tightness and spasm and guarding in the pelvic muscle. So those are a couple of different kinds of vaginismus, if you will.